Hi, my name's Chris Langley. I'm the host of Addiction Recovery Place podcast. I'm very pleased to announce our next guest is Kay Guire, who is the Executive Director of Personnel Frontiers, a CRA accredited Wyoming Certified Partner. And this service was established in 1976. So welcome, Kay. Thank you.
Thank you.
Looking forward to hearing all about your program that you guys have in Wyoming. Tell us about the drug use program and how this works at your service.
So, we're an intensive outpatient service. We offer outpatient services to clients that have been referred to us through a assessment. And then we cover a lot of different types of addictions.
Okay, so how do you get your referrals? Who refers clients?
We get them, some are self referrals, some are probation and parole, the
Mm.
judicial system. We get them
Yep.
from all places, really.
Okay. So I see you have different stages of recovery within your program. Can you tell us a little bit about the initial stage? So what someone expects when they come to your service for the very first time, especially if they've never engaged with a drug treatment service?
So, usually we start out with what we call an ASI, which is an alcohol substance index survey. And so we
Mm.
start out with that and they get recommended to whatever level of care from that. It's about an hour to 2 hour interview with a clinician. Once
Mhm.
they get that, then a lot of times they're referred to intensive outpatient program, which we run that. The whole program is 6 months long, but there's three different phases to it. We start
Right.
with intensive outpatient, which is the most hardest stage. We have them for 9 hours a
Mm.
week in groups, and then we
Okay.
have individual counseling on top of that. And then they move to relapse prevention, which is also a 2 month program for 4 hours a week with individual
Mhm.
counseling. And then
Mhm.
aftercare, which is 2 hours a week with individual counseling.
So the length of the program is roughly how long again was it?
6 months.
6 months. So okay, so it's quite an intense program. So what happens if someone disengages, especially if they're on a court order?
Well, we usually try to work with them as best we can, not,
Of course.
people relapse. I can't tell you how many
Mhm.
times, unfortunately, people relapse, but it's our business and that's what we're
Yes.
here for is,
Mhm.
not everybody's gonna stay on the road and that's okay. Just, hopefully they're learning as they go. And
Mhm.
so, we don't just kick them out of our program just because they had a bump in the road. So
Mhm.
we work with them, we get them some extra counseling and see what caused the relapse or what they could do
Mhm.
better. So it's
Mhm.
definitely a process.
Of course. I mean, it's something that people go back to time and time again until they're at the right stage in their life to kind of, you know, deal with their addiction and all the other issues that come with that. So so you work with people experience addictions to alcohol and drugs. So do you have clients who have addictions to both of these within the same group, or is it a separate kind of group? You have an alcohol group and a drug use group.
No, we look at it as addiction. Alcohol and
Mm.
drugs are similar and
Of
sometimes are
course.
co-current, right? Sometimes
Oh yeah.
they could have a opioid diagnosis and they can get better from that and then they could turn to alcohol. So we definitely look at it as one thing and try to take care of it and figure out how to prevent from you going to
Hmm.
whatever source or
Hmm.
substance.
Hmm. That's good to know because sometimes the reason I'm asking that is because in the UK it's kind of a separate issue for some reason. I've never, as an old practitioner myself, never understood that. So that's good to hear that you have, addiction is addiction, and that's how it is, and everyone should be together supporting each other. So, so what would you say the main drugs of choice are within that you're seeing in Wyoming? Are there any new trends around drug use at all?
Fentanyl is probably the worst right
Yeah,
now. It's
right.
across the nation. It's
Hmm.
definitely it's more deadly than I've seen a lot of drugs, and
Hmm.
it affects people's lives a lot differently than I think, like marijuana or some of those lower level drugs. But fentanyl's for me, that's the scary drug, and we've seen
So,
lots of that in our system.
so has that been kind of a new phenomenon? Would you say,
I
or
would
has it
say
kind of steadily been?
it's been increasing. I think when it first started, it was kind of a catchphrase, but now it's just everywhere. It's in everything, so it could be in
Mm.
the cocaine, it can be in the
Yes.
any of the drugs can have that added fentanyl in it, which makes it sometimes lethal.
Oh, completely. It's a new thing that seems to be really cropping up. I mean, we're even getting it in Europe now, which I was quite surprised about. And you're having these new drugs come in, and it's just mixed with everything, as you say, with the cocaine as well. And it's It's very scary. I mean, it's very different to when I was, 10 years ago when I was working in the field in the UK. This was never a thing. We had different kind of things. We had cocoethylene and things, but we had never had anything as strong or deadly as fentanyl. And so that's a really worrying trend. And hopefully they can find a solution to this problem, because it needs to, because so many people are dying around the country and around the world now because of this. It's yeah, it's very, very frustrating. Oh, incredibly, and it's it's a kind of, it's another level of drug use that I would never have imagined would have come onto the come onto the scene, really, because it does literally kill the people
Yeah, it ruins
that it's
families
that they're
fast,
using.
for sure.
Yes, indeed, it is truly tragic. I'm just going to move on a little bit, because I see that you're starting a new program for to help with gambling addiction. Now, in my view, this has sadly been one of the addictions that's kind of been put on the side, where there's not too much support, especially in the UK. So this is obviously a huge problem for problematic gamblers and their families. Can you tell us about your new program, Kay, and why you started this at Personal Frontiers?
So I agree with you. I think gambling addiction or problematic gambling is something that's not talked about a lot.
Mm,
There's very few people that go to jail for gambling. So a lot of times I think it's like the unseen addiction.
yes.
People don't necessarily get diagnosed with gambling addiction, but I have seen that it's co-current with our population that we serve. But with that, there has been an upcrease in sports betting, which affects our younger population also. So
Mm,
we don't have any kind of program in our community. We're kind of a rural community in Wyoming. Wyoming's pretty rural
mhm,
as it is. And to not have those kind of resources, I wanted to pioneer us being the first to be able to say, hey, we're going to breach this subject and we're just going to get prevention out there and then provide treatment. Once we
mhm,
have the prevention out there, you have to have some sort of treatment for those that identify with that. So I'm pretty excited about that program just because
mm,
it's new to our area and
mhm.
it's definitely much needed. We just got funding for it last month, actually. So we're going to be
Hey,
starting the
good.
rolling it out in the next couple of months. I got some training I want to do with our
Mhm,
clinicians and then, of course, just finding people. But we have in our community, horse racing is a big thing. So
mm.
I'm hoping to get it into the horse races and be able to provide prevention material through the summer.
Oh, that's interesting. No, that's wonderful to hear, because it does seem to be in the United States, with the new the law changes that have happened, especially with online gambling and these new casinos just opening up everywhere. Even here in Omaha, Nebraska, near where I live, it's just exploded. That's the sad thing, isn't it? I mean, so what would you consider to be some of the biggest triggers to gambling addiction? I mean, you've
Well,
just spoken about casinos, so
right, right. A lot of times people are trading one addiction for another. So, like in
Mhm,
our community and the population I serve, I'll see people that are getting clean from alcohol and drugs, but
mm,
they still are looking for a certain type of high and they turn to gambling. And now that's a prevalent thing in our community that they can do. And especially with our population on probation and stuff, they can do that legally, right? But it can also cause them as much harm as the substance itself.
mhm,
They're trying to rebuild their lives and then they're gambling on top of that and they're losing
mm,
money,
mm,
occasionally, probably occasionally winning. But it's
mm.
definitely a trigger is just, and for us here, there's not a whole lot of things to do. We've got the great
Yeah.
outdoors, but if you're not an
Mhm,
outdoorsy person, we don't have a lot of art places or anything like that.
mm,
So I think it's easily entertainment
mhm.
purposes. So I think those are a couple things that attribute to our problems around Wyoming.
So what things are you going to be putting in place to go to the, regarding harm reduction with gambling? What are the kind of things you're going to be doing as an agency?
So we want to target, we've got two audiences that we want to target for the prevention part of it. Obviously, we'll be working with our clients, but that's a no
Mm,
brainer because that's what we do. But I would like to target high school and college kids. And so we're going to
yes.
be offering a 6-week course about problematic gambling, responsible gambling, what it looks
Mm,
like, what does
mm,
gambling mean to you, and how it can creep into your life and not even know it. So
mm,
that's one of the courses that we're going to offer. I'm pretty excited about that. We have several schools here that we'll partner with, and then we have a local college. So we'll be able to hit that college level too. The other thing we want to do is get into the senior centers. And again, they're to talk about problematic. Yeah, man, when does it become a problem? And
Mm,
so a lot of talking in places is what we're going to do, just really making the awareness out there.
yeah, good for you because there's obviously a need for awareness around this because, like you said, it just creeps into people's lives, and the next thing they've got a real problem financially and mentally, and everything within their life can just collapse without them even seeing it coming, unfortunately. So that's, yeah. I mean, I've worked with a few people that have had gambling addictions, but never intensely. So I take my hat off to you for doing this because it's much needed. So thank you for explaining that, Kay. Your outpatient service and case management service. So how does your team case manage each client?
And then the core program is 6 months, but we have clients that stay here for years. We do
Mhm.
mental health after that, and we do follow them around for quite a while to, check up on them. One of the things we do is we always offer, our doors are always open to them, right? So when they do graduate the 6 month program, they can always come back and get case management or peer support or come to one of our groups for free. I think that's just something nice to offer to, so they can keep those connections. So we do a lot of case management. So we don't just look at the individual as, you're here for substance abuse treatment. A lot of them are struggling. A lot of the ones that we see, they have no house, they have no car, no job when they're coming into the program, no money. So paying for for substance abuse is prevention is almost hard for them because they have nothing.
Mm,
And so,
mhm,
we offer budgeting classes. We have a nice list of apartments. We'll help them get apartments, call around, we'll help them fill out applications for jobs. So that's kind of the whole person view that we take here. And we have a couple really good peers who have gone through substance abuse issues themselves.
yes.
So they
Mhm,
really resonate with the clients.
mhm. Yeah. Wow. So you do the whole service. I didn't realize about helping with the housing and all the life skills thing. That's incredible. So someone can come to you and get some help for other kind of things as well as their drug use or their alcohol or their gambling. So you're hoping to offer medication management for people who are diagnosed with mental health issues. How's this going? And is the service started yet? Or
Yeah, so that's one of my big passions. And I also believe that a lot of our
mm,
clients have pre-existing mental health issues that haven't
mm,
ever been addressed, and that's why they've
mm,
either turned to substances to self-medicate or to
mm,
deal with their life. We do contract out with a nurse practitioner, and she spends 4 hours a week here, and we get to our clients get to be priority in that. So she'll diagnose them, and then she'll offer them, she'll work with them to find the right kind of medication for them, which I
mhm,
also think is very important to do in a controlled environment. We
mm,
have access to her, so if something's not working out, we can definitely get them help and figure out and adjust as needed. So I feel like a lot of
mm,
clients that go on mental health meds, sometimes they're like, "Ugh, this isn't for me," and they just stop. And
mm,
so that's something I'd really feel very passionate about is being able to find those services in the nation. Wholly, it's hard to get those kind of services for normal people. To get into
mhm.
like a doctor is like, you got 2 to 3 weeks waiting, where
Yeah.
this allows our patients to be seen without the wait.
Yes. Yeah, that's very important. Working with dual diagnosis clients is a vital component for any service. Because in the UK, we have it's quite different because we have drug services, we have mental health teams, and mental health teams won't work with people that are still using alcohol or drugs, and drug services won't work with people unless they're accessing mental health services. So the fact that you've got this within your team is no, it's very admirable. So you contract out the that team member externally, and what's the uptake been like within the community? Is it keep keeping busy with that service?
Yes, she never has a spare moment. Her whole hours that we have her for are full each and
Yeah.
every week. So, which is for me, I'm glad about that because that means
Mm.
the service is definitely needed.
Yes, definitely. Oh, fantastic. Last couple of questions, Kate. You have an aftercare program, which is one of the most important programs, I believe, for when someone's been accessing services for especially for as long as 6 months or beyond. So when do you decide that someone's ready to fully disengage from your service, and how do you put together an aftercare package for them? And what does this involve?
So, in our whole program, we have assignments. So there's certain things that we have them work through with their clinicians. They work through in
Mm,
group. We have a curriculum in our groups. And
mm,
so they have so many hours they have to complete. So that's kind of the completion of the program is if you get all your hours in, all your homework done, and then also all your individual therapy done. So that kind of dictates the completion of the program. That's when they graduate. So that's when we make a big deal. You've done it, right?
mm,
But then we don't feel that we don't just say, hey, go out to the world and be good, right? We say, come back. If you need us, we're
mm,
here. That's something I'm
mhm.
very passionate about. Our clients are always welcome to come back. We do follow-ups with them up to 6 months afterwards. So we're seeing them. We usually see them for mental health counseling far
Yes.
beyond the 6
Mm,
months that we have them in for treatment. They usually stay here
mhm,
and keep their clinician, and we see them either biweekly or monthly or as needed. Some of them get out there and they're fine and their worlds are great, and they'll come back and just say, "Hey, I'm doing good." And that's why I do it. That's the good feeling that you get is when you see a client doing well.
of course, that's one of the best parts of the job, isn't it?
Yes, it is.
When you know that you've helped someone to get to that next place within their life in a positive way. So no, that's wonderful. Do you offer any peer support program?
We do. That's something that's kind of new. I feel in the United States, we have 3 peers on our thing, and actually all 3 of them went through our program. So that's kind of been a nice little good feeling too, is to have
Mm,
people that went through a program and we get to hire later, right? To mentor
yeah.
other people to be successful in that. I think
Mhm,
that peer support is probably the most important part of the program. They're the ones that actually resonate the most with the clients because they're
mhm,
coming from a place that, they understand because they've been there.
yeah,
They've gone
yeah,
through the addiction. They've come out on the other side. They're being very successful. They can
mhm,
tell how hard it was. And, they have great advice for them, and they can just reach them a little bit differently than a clinical person that, maybe hasn't ever had an addiction problem. They have a lot of
yeah,
schooling, but really, do they
mhm,
know, how hard it is? Deep down, do
mhm,
they know how hard it is? And I think it just meshes everything together.
yes. Yeah. Oh, that's wonderful. So you've got 3 people as peer support people at your place. That's amazing. A couple of things I want to speak to you about before we finish. Tune-up sessions. So that have left the program can come back at any time. So, and this is open for what period of time? So they can come back at any time to you, yeah?
Yeah, open as long as they need it. And we do have people that utilize it, which is wonderful because I think sometimes just knowing where your resources are and having
Mm,
that culture of, hey, we're an open door. You're welcome here at any time. And some of them will be gone for months and then they'll possibly relapse and say, hey, I need to get in and
mhm,
talk to somebody. And
mhm,
that's part of what being a nonprofit lets us do. We can offer those services for free and say, hey, we're
mhm,
open, we're here.
mhm,
And sometimes it might be they come back and we need to help them get into other services.
mm.
So that's I think that's just the continuum of care that all agencies should try for.
It's certainly the model to have, that's for sure. So you just said that you're a non-profit. So how do you get funding, Kay?
We get a lot of funding from grants. I do a lot of grant writing. We have our city and our county support us greatly. We have a 1% tax that they give us a portion of every year that we use to fund our sliding fee scale. So that helps
Mm,
clients that can't afford treatment or don't have
yeah,
insurance, which isn't the majority of them, afford treatment. So we have great local resources plus all that outward. Like our gambling grant was a local thing, and I'm reaching out for a national grant from help us with their gambling program. So it's just a lot of goodwill, I guess.
definitely, definitely. No, that's very impressive indeed. My last question, relapse prevention. It's one of the most it's important stages, I believe, of any addiction program. How do you prepare someone to prevent relapses to drugs, alcohol, or gambling?
So that's when we talk
Um,
about the hard stuff. We talk about,
yep.
what triggers you? Why does it
Mhm,
trigger you? Where did that trigger
mm,
come from? And how do you handle that trigger? Not just triggers, but also what else can you do that can make you feel sustained?
mm,
What hobby can you have? We do provide one of our peers takes them to NA so they can get connected with an NA group or an AA group or Celebrate Recovery, any of those groups that are
yeah,
outside of our services and not so intense, but it's a kind of a group setting where they can get their own people, I could per se. But yeah, it's going through the hard stuff. It's trying to figure out what causes you to want that. and how can we make that better for you? And what can you do for yourself that fulfills you just as well?
Mhm. So it's like identifying kind of things that you won't be able to identify if you weren't kind of aware of it. It's kind of, I think with relapse prevention, it's those unexpected triggers that people don't realize, and then suddenly they're sliding back slowly again. So I've always believed relapse prevention is one of the keys around drug addiction help. So that's wonderful. Is there anything you'd like to tell the audience about your service and what's the future for Personal Frontiers?
I just hope it's bright and shiny. I think it's a needed service. I am very passionate about what we do. We've been through some struggles through the years, but we've come out on the other end. And I think that helps us even when we help people that have struggles in their life. We can say, we relate in a different way, but
Mhm,
just that we're here, and if you know of anybody that needs help, our doors are always open.
mhm. And how can people find you, Kay?
They can either call us. We have 768611189 as our direct line. We have a
Mm,
wonderful Facebook page, and we have a website, and
excellent.
that's at personalfrontiersinc.org.
Thank you very much for that. Kay, thank you very much for your time from your very busy schedule today. Really appreciate it and look forward to telling all the audience about your wonderful service in Wyoming. So thank you very much indeed.
Yes, thank you.
Much appreciated.